Welcome. You've just tuned in to ICRC's TV, HR, and business updates. My name is Pandy Pridemore, and I am principal and founder of the Human Resource USA. We want to welcome you to the show. Well, it's been 5 months. Did anybody happen to notice that 5 months just slipped away? We blinked and COVID began, and now we're in the midst of it. And everything has gone so extremely fast. We just realized in looking at some of the things that we've been doing for the show that we've done, I think this is like our 20th or 21st episode of this show. And the material has been absolutely amazing. We have brought in speakers on topics ranging from databases on tracking COVID, all the way through IT challenges. We've talked about staffing and unemployment, and then we've swung all the way back to employee benefits. We've tried our very, very best to provide you with the best information on the most relevant and current topics we could possibly come up with during this COVID period. So it only seemed to make sense to me that maybe we should just stop here for a moment and take a breath. I mean, isn't that, I know that Scott work, and I have told you a million times, there are times when you just have to stop and take a breath before you jump into another mess, because it's always going to be there waiting on you. So I thought we'd take this show and just stop, back up for a minute, and actually start thinking and taking note of what we've been experiencing over the past 5 months and what we've learned from those experiences. Now, every one of you is going through this differently. So there is no one solution for all of you. But I thought maybe if we could listen to the experts and have them talk to us about what they've seen in the past 5 months, and maybe what will work for you today and moving forward through the next 4 months. Because remember, COVID, the pandemic is here till December 31st, at the end of the year, well, unless somebody decides to extend it. But if we've made some really good strides and we've found some really positive things that are working for some companies or a lot of you, then why not continue to share those? And let's decide what we need to really focus on and concentrate on for the next few months, maybe into the next year. So today, I have joining with me the founder and one of the principals for Saxon Financial, Jamie Charlton. Jamie's been on the show before, and Jamie came on to help us understand all those major changes with the carriers, the health carriers, and what they wanted to do to try to help businesses through the introduction of the pandemic. Well, today he's here to not only refresh our memory on all those changes and where we are currently, now that we're 5 months into that, but also how those changes may continue on, and goodness knows how they're going to affect any of the future enrollments of employee benefits or anything else that may be coming forward. And then I also introduced a new presenter. This is going to be good. I have Bob Brown, partner with Graydon, a law firm here in Cincinnati. If you're anywhere in this market, you've heard of Graydon. But Bob serves as general counsel for a number of small businesses here in this area of the country. And not only is he working with small businesses as a general counsel, but he also helps individuals who want to come in and start their own business and do franchises, which is really, really unique. And then we're going to get his insight on all those aspects, because we really haven't talked about the business owner side and some of their challenges. And then I've got a whole list of things I want to ask him. So he's going to give us a fresh new look on business and some of the challenges. And then later, I've got a whole list of things that we need to talk about, because again, there's some things that have been coming back up in terms of feedback that I've gotten from our viewers and that we need to kind of refresh our memory on. But I've also added a new portion to the show. We're going to have a training tip every week. You know, you've heard us say over and over and over again, training is absolutely essential. And so I decided, why not? I'm just gonna identify it out. We're gonna throw it there. We're gonna show you what to do, but we're gonna talk about a training tip for each show. So again, let's just get right to it because we've got a lot of material. Jamie, Bob, welcome to the show.
Thanks, Tammy. Looking forward to it.
Great. Jamie, let's start with you. Again, you were here a couple months ago, actually. Mm-hmm. And at the time, it was really exciting because all those big carriers were starting to make accommodations for the furloughed employees. They were starting to provide some concessions to the employers in terms of how they made their payments. These were huge, huge changes.
Yeah, it was unprecedented times, as we know. Before we get going, though, I just want to make a plug for Governor DeWine. He approved all fall sports today. So, as a father of a senior soccer player, thank you, Governor DeWine. So big changes personally, but from a business standpoint, yeah, the carriers were very accommodating. I mean, as we all know, nobody knew what to do when March hit. It was a time that a lot of us have never been through. So as I mentioned in the show last time, the carriers really stepped up. I felt I've been doing this for about 20 years, and they really made accommodations to help those small businesses that were in need until the CARES Act got passed and the other actions by Congress got submitted and passed to help out the small business owner. They really came to the plate and deferred premium payment for a while. The COBRA law got passed to where until we figure out when this thing ends, COBRA right now doesn't have to be collected. So they've done a lot of things. I think through the PPP loans, though, so small business owners have had time to regroup and come back and understand where they're at in place. So you're starting to see a normal flow of business again with the benefit world. Now, a lot of the ancillary carriers stepped up too. Obviously, medical drives most of benefit plans because it's the biggest, most political football we talk about when it comes to benefits. But I also got to give kudos to the ancillary guys, the disability carriers, the dental carriers. Those carriers have frozen premiums as well, most of them for the remaining year. So a lot of these groups are going through renewals right now with any type of increase. And even some are going back on premiums, meaning not back, obviously they're not going to take premiums back, but are also reducing premiums.
Wow. So
we've seen a big step forward by these carriers. They usually get a bad rap, especially this time of year when we have a presidential election coming up. I'm sure we'll hear all about health insurance and how bad it is and how terrible the carriers are, but they really put their best foot forward, I think, when this pandemic hit.
Did it have a major impact on the carriers to make that decision? Because again, they've been accused of all sorts of things in terms of their profit margins, but do you think it made a huge impact on them, or was it actually good for them too?
Well, I think it was good for them from a PR standpoint, and I think it was good for them because they had to regroup. I mean, they've never been through this before, So they have the government telling them that they've got to pay for all the COVID testing. Any COVID testing or any COVID malady has to be covered as preventive care now. So that's a big change to their business model. I mean, it'd be like you walk into the UPanty and saying, "Okay, we're having an HR crisis. You have to give me all of your HR secrets for free, or a particular aspect of your HR service. Say it's compliance. Say, okay, well, you know what? We're having a compliance crisis. You have to give me all your compliance secrets for free. And oh, by the way, I'm not using you over here for payroll or anything else. So I'll kind of keep paying those, but this part of your business you have to give to me for free." And that's kind of what happened to these health carriers with COVID. I mean, everything from testing to God forbid they had to go past for patients that had to go past testing. Those services were covered. And so, yeah, it had a big impact on those carriers. Now, as we mentioned a couple of months ago, we'll see as these carriers shake out, how long this goes. The carriers are also doing okay because a lot of elective procedures aren't happening right now or weren't happening for the last few months. I know some of our specialists have started to open up and hospitals have started to open back up for elective procedures, which is good. And that's really the high cost, other than the prescription costs, that's really your high cost drivers for healthcare, or, the hip replacements, the things that are elective. Obviously, heart attacks and those are not elective, but, things that we take for granted knee replacements, hip replacements. A lot of people put those off because the hospital shut down, or people were just scared to go to the hospital because they didn't want to come out with COVID. So a lot of those expenses that normally go into a health plan were not occurring for the first few months, and not sure they really picked back up full steam. So the carriers should come out of this pretty good.
Wonderful. In terms of the employer's perspective, what do you think we learned as business owners through the past 5 months? Because that was a huge surprise to hear the carriers do that. That blindsided a bunch of us. But do you think we learned anything else, or have you heard from your clients any other observations from the past 5 months that, what might be easier or more palatable to accept?
Yeah, I mean, unfortunately, from a benefit, as we talked about, I mean, the world kept going on. I mean, the carriers are gracious enough to give them a grace period on their premiums. But remember, premiums still got to get paid because doctors and hospitals still have to get paid. So those carriers have to collect that premium. So the world didn't stop from a premium standpoint. It got put on pause. But in order for those policies to stay in place, those employers had to catch up those premiums. Mm-hmm. I think one thing that's happened is I think we've seen a lot more advancements in technology in the industry really quick. Now it's been there, but it wasn't as Americans, we're very accustomed to the way we've used healthcare in the past. Mm-hmm. I want my copay. I want to go see my doctor for $20. I want to go get a prescription I want to get it for whatever my copay is. I want to be able to walk into Kroger and pick it up. What I think has happened with COVID, because the hospitals were, quote unquote, not safe to go to, and some of the prescriptions we saw, got utilized pretty highly, and people hoarded. You saw the run on toilet paper, those types of things. Well, same things happen in healthcare. So I think a lot of consumers have adapted technology. Telemedicine became a huge hit in the last 3 to 4 months. It's been around for 4 or 5 years. People is always foreign to us to get on internet, like you and I are doing with Bob today, and talking via computer. Nobody ever thought about that with their doctors. Well, no, I got to go see my doctor in person. Well, now it's I think it's here to stay. I was at the client this afternoon. We were talking about it. It's here to stay. Programs like GoodRx. You probably see the TV commercials for them quite a bit if you watch TV. The discount prescription programs now. Again, we've become better consumers through this. So I think the good thing for employers is embrace the technology, embrace these savings that these carriers are they're not pushing it. Again, insurance companies get a bad rap because it feels like they're just trying to cut corners. Mm-hmm. And, these programs that come out, telemedicine, RX discounts, we're seeing very select formularies now. So what the carriers are doing, again, RX for prescriptions is the #1 cost driver in healthcare. So a lot of these carriers are saying, okay, you know what? These are going to be our preferred prescriptions. You can live with these. These will save you money. If you want to pay a little bit more, we're not saying no to you, but you're going to pay more for these brand names. I think when we slowed down and kind of realized what we could and couldn't live with, some of these programs have come to the forefront, and I think they're here to stay. And they should make health insurance more efficient for both the carrier and the end user, which is the employer and his or her employees.
What about the 401k side? I mean, you and I talked briefly that the Secure Act came out right before this, last fall, and everybody was trying to digest all those changes, and I mean, there were some really nice concessions in that as well, but my gosh, again, here's a major body of a government body that's overseeing a huge area, and I was just reading a paper this afternoon about, the likelihood of a DOL audit is more on the ERISA side than it is, which also oversees benefits, than it is over anything else. Do you foresee any major changes in that direction now that we've gone through this past 5 months and people have had to dig into their 401ks, they've had to dig into those reserves and use some of those concessions that the Secure Act offered? Yeah,
I'm gonna speak from the 30,000 foot level here because that's not my forte. But if any of your viewers would like a more in-depth discussion on this, we have a specialist in our office, Todd Jowett, who does nothing but 401ks all day, every day. But yes, Pandy, to your point, it had a down effect on it. Well, so I'm going to go macro that it had a down effect for people needing their assets, so people going into their 401k, but also, when this pandemic hit, the market dropped significantly. We were coming in the first quarter, the market was all-time highs. COVID hit and the market took a pretty big nosedive. Now it has rebounded, so hopefully people have stayed invested in their 401k, because the whole point of 401k, is buy low, sell high, or what we call in the market or in the industry dollar cost average, which means every time you put in money in your 401k, you're buying at different levels. I'm not going to give that a whole speech, but my point is, if you stay the course, you can ride the ups and downs in the market. So hopefully everybody was able to do that. But there were those few that, God forbid, they were laid off, or the common term I know we spoke of and kind of scratched our heads with one of your guests on the show was the word furloughed. I don't know if you figured that term out yet or not. But for those poor folks that were furloughed or let go, we're still seeing that, people that don't have that income coming anymore. They have to go into that 401k. So again, there were concessions made there. I know in talking with Todd, the 401k world's kind of slowed down a lot. A lot of employers have kind of pumped the brakes on matches, which obviously hurts the employees, because we're living in uncertain times. And to expound on that, we have a very contentious presidential election coming up that will or could shake the market as well. So yeah, the 401k world's been a different place this last year, and I think it will be for the next few months until we figure out what happens at COVID, and then what president gets elected.
Yeah. Again, like you said, there were changes and decisions made that none of us were expecting. Do you foresee, or do you hear any rumblings that anything is in the works with the legislation that they're debating on right now that would affect employee benefits?
Well, it's been going on since 2010 when, the Affordable Care Act got passed. Every year it's something different. And this year, again, it's no different with the presidential election. A very, contested presidential election comes up, regardless of which side of the aisle you're on. So, do you listen to President Trump and, we're going to continue to get rid of the ACA, which really hasn't happened in the last 4 years? Or you listen to Biden camp, who says we're going Medicare for all, which, the ACA was supposed to help us do, and it really hasn't, because the affordable part of the ACA is not affordable. It's hard for me to sit here and tell your viewers which way to believe, because it's been a political football for a long time. And my personal belief is there's just too much lobby and too much money tied up in healthcare between doctors, hospitals, the government, pharma manufacturers, us in the insurance industry. It's just too big of an industry just to change overnight. And what often gets left out is what do you do with the specialist when you tell a specialist, hey, we're going to go Medicare for all, we're going to cut your salary by 40 to 60%, because that's what Medicare reimburses you. Now, I'm obviously being a little drastic with that statement, but that's kind of what that would mean. And that's why when the ACA got passed, you saw all these carriers cut their networks so much, because networks are expensive, and the hospitals and doctors make most of their money on the private networks. So to summarize it, I'm not going to give a good answer, because it's such an ambiguous topic that there really is not a good answer. And I apologize to you and your viewers for that. I feel like I'm letting you down, but it's been up in the air for 10 years now, and I'm sure it'll be for the next 10.
They want the truth, Jamie. That's what they want. The viewers watch this show, at least the ones that I've talked to, they just want to know the truth. Just be transparent with them and tell them what's going on and why, as much as you know, as an expert, as much as you know as to why it's happening. Some of them aren't getting information from their business owners, or the business owners don't know how to translate much of this. And they don't know if it's safe. They don't know what kind of reaction they're going to get. And quite frankly, you don't know what kind of reaction, your employees are going to get. I go off of the reaction of all my clients, and we're all going about this differently. So you can't let anybody down by telling the truth.
Yeah.
That's pretty much it. And Bob, that's a good segue for you to come in, because you're you're helping your clients understand what the truth is when it comes to all the things that they're going through. And we haven't had anyone with your expertise on the show. So this is a real treat for me, because I want to hear what you've seen and what you've been able to build together in terms of a story of your experience over the last 5 months, and some of the things that actually been lessons learned from your clients.
Well, the lessons are every day. When the pandemic hit, Graydon decided that we were going to begin a coronavirus task force. I was asked to be the chairman of that task force. I thought, probably a couple months we'll kind of take care of this thing, take care of clients. I didn't realize it was a lifetime appointment. So it's been a real eye opener, and it's been a whirlwind, especially during the time, because a lot of our focus is on key issues and all the different things that the Department of Treasury and the SBA have issued, and in the late March through early May was a particularly busy time in decipher an ongoing, an ever-changing program with the PPP. The initial issues were, hey, do we qualify? Because there were employee limit as far as how many employees a business could have before they qualify. And then towards the end of April, one of the big issues became whether or not those companies that had applied, because everyone saw the opportunity to take advantage of the program. And most were very legit in doing so. But then word came out that a lot of major companies, high-profile companies, I'll just mention the Los Angeles Lakers were one where it just had people scratching their heads saying, how can this business have no ability to get other funding and other resupply for the PPP, and that started a big backlash. As a result, that gave everyone sort of a 2-week period by which they could look at their inner selves, make sure that they really need this program, and if they withdrew their application before, I think the date was March. Initially, it was May 7, and had a lot of calls with clients saying, we think we are qualified, that we certified our needs. We really believe we do. And we would analyze it to see, hey, do you qualify? And we would give a pin. Yes, no, we're not sure. We don't know how it would be looked at, because the Treasury Secretary Mnuchin and President Trump at that time, they were going to bring down the hammer. They were saying, hey, we're going to audit. We're going to really take a close look at this. They extended that sort of grace period another week. And a lot of people then just went ahead and said, you know what, I'm just going to turn back the money, or I'm going to withdraw the application. We're just not complete the process, sort of a cleansing. And it was remarkable how much funding was then available to companies that really did need it, and all that sort of thing. So that's like crazy. Once we got into sort of midsummer, the program was moving forward. It seems like it's done a pretty good job. I mean, I think a lot of companies have taken advantage of it. A lot of, most companies, because there was that fear in March of complete disaster, and no one knew what was going to happen with their employees, and would they be able to hire them back. I mean, the restaurant industry, as everybody has been essentially decimated by this. We've lost a lot locally of just good restaurateurs, and they've just had to back out. We're now in the forgiveness period. Determine whether or not the funds that were issued to companies, we're coming up to the period whereby they can now apply to the SBA, or actually apply to the bank, to the actual lender, to have their loan forgiven. They have to demonstrate how the monies were spent. It's not an easy process. I've seen a lot of form worksheets issued by companies. every company's accountant has been very active in helping their clients get through this. We've supported them throughout as well. A lot of banks so far are saying, hey, we're going to hold off before we start accepting forgiveness applications, because quite frankly, the rules might change. And it's not sure what, there may be certain companies that automatically will have the loans forgiven depending on the amount that they took out. So it's been a whirlwind. And that's just one segment that we've dealt with. We've also got our HR people, Lee Geiger and Dan Burke and the other employment lawyers with our firm. They're dealing with the day-to-day issues, Pandy, that you work with all the time, helping employers get through that. Our employee employment benefit folks are super busy. Our commercial real estate team is extremely busy. Right now, I would not want to be a commercial real estate landlord. Companies have found out that they don't need the amount of every company, whether it's a law firm, accounting firm, whether it's just any type of company, they're reassessing the needs for space, and that's going to be a big change. We have a lot of clients who are small to medium sized that they need help from their landlord. They need some sort of concession because been there. Whether it's I can think of examples, at least for me, from my client base, salons of any type, restaurant, almost anything you can think of. The schooling companies or those sorts of folks. It's been all over the lot where they need some help, but on the other side, the landlords have their pressures as well. So it's going to be an interesting fall. It's going to be early 2021. Who knows what's going to happen? But from a legal advisor point of view, it's been busy just from. I liken it in some ways to the late the 2008, 2009 timeframe when, unfortunately, all the calls were desperate because of the financial crisis, and this is another crisis, as opposed to 2, 3, 4 years ago, where a lot of it, the discussion is, hey, we're looking at buying the company, we're looking at growing, we're doing this, sort of what I call the happy calls. We're still having some happy calls. I'm surprised. I'm frankly surprised there's still quite a bit of M&A, mergers, acquisitions work going on. I've got several people who are getting into franchises, which I think is a real positive to see that activity is still ongoing. Because I tell you, back in March, April, you're thinking that's not going to be a busy time for us, but it has been. So what's ahead of us? I'm not sure. I wish I knew, because it's crazy. It's crazy.
Have you heard any of your clients talk about, as they started preparing and trying to find all the information they needed, they started actually talking about their risk management of all of it? I heard just conversations of, I probably need to relook at my operating agreement, or I need to look at what that individual is responsible for versus what I'm responsible for as business owners. I thought it was interesting how many clients I had who talked about how just unhappy they were with their banks and how they were going back and reviewing the loans because they really didn't know the paperwork. Is that language that you were hearing as well?
Yes, people were, because in some instances there were, for example, clients who did kind of talk to their banks and they weren't sure what was there. I think companies are reassessing all those sorts of things, all those bits of risk management, just saying, okay, how are we positioned for this sort of thing? This happened kind of out of the blue. I mean, I specifically remember a manufacturing client here who does a lot of work over in Hong Kong, and having discussions with them back in, I guess it was September, October, when Hong Kong was getting hit with the coronavirus, and say, yeah, they're all shut down, and gosh, we're having to deal with that sort of thing. And, you never realize in 4 months it's going to be center here and just dominating everything. But I think people are. I think they are it's causing folks to look at their systems, whether it's a management system, whether it's their security system. That's another aspect that I haven't touched upon. I'm not the expert in our, but the privacy and security aspect of there's just been a spike in ransomware attacks, malware type with business clients who are so focused on just trying to get through the crisis and all the other issues with the pandemic issues. And for lack of a better term, sneak attacks are coming in, and it's there. I mean, I've unfortunately had a couple transactions last year that had issues involving malware incidents, and that was when this is pre-pandemic, and those have increased. So people are having to take a look at their IT and security operations as well, and also looking at the insurance policies that they ought to be carrying for that sort of thing too. It's just, I think, to answer your question, Pandy, I'm rambling a little bit. I think it's causing business owners to take a look at just about everything in their business. All during the while they're still trying to make money, survive this, but there is that introspective tact that they're now moving forward with.
Yeah, Jamie, I'm going to ask you, and Bob, you be thinking, because I want you next, but what 3 things do you think from what you've been talking with your clients, what 3 things do you think the most successful ones did? Or what were the most positive things that some of your clients did that really helped them kind of scathe through some of this?
Well, I think the first and most important, and I think it's one of the keystones of any key relationship, is just communicate. What we found out is our those employers that got out and reassured their staff, whether it was good news or bad news, what to expect. So I guess to expound on that, it'd be communication of expectations. What, we don't know what's going to happen. We've heard news. We've heard there's going to be loans. We don't know if there's going to be loans, but we'll keep you in the know along the way. So I have found that's really was number one. Let your staff know where to go. The second one I would say is for those folks who did get caught off guard with this, intentionally or unintentionally, was taking care of those folks, reassuring them that, hey, you know what, we're going to have a setback, but we'll bring them back. We've had a lot of groups that have had, initially panicked and let some people go, but then brought those people back. And so, I think that's good. That was a big one too. And lastly, I just think, it's hard to say because you never want, especially in the niche that we work in, which is small business, cash flow could be up and down depending on the industry you're in. But those that had, it's number one tenet in the financial industry world or financial planning world, they have a cash reserves. Now, I know it's easier said than done. I've been a business owner. I remember the first few years, or I am a business owner, I should say, but I remember the first few years starting up, cash is hard to have. So, depending on where you are in life, but if you can have that, those who had that cash reserve that were flush with cash, they're not hit as hard as some of the other companies. Now, if we stay on this path, will they catch up to them? Sure it will, but they're the ones that are weathering the storm right now pretty well. When I talk to my clients, depending on what industry, Bob hit on it, a couple of different industries, just unfortunately not much they can do there. I mean, they've been hit pretty hard, but so yeah, communication, of expectations, taking care of your staff, and then preparing for that rainy day. One way, cash to it, it may not be cash in the bank. It could be a line of credit. I know a lot of business owners are opposed to lines of credits because they think it's a bad thing. But we have a lot of business owners that really drew on that line of credit and it saved them. So just be prepared for that rainy day because you never know when it's going to come.
Agreed. Bob, what about you? What did you think? You had to have had that day when you looked at somebody and went, oh, gosh, you were smart to do that.
Yeah, and and I echo Jamie's first point as far as the communication for any business. I'll draw upon center here at Graydon. It's been a very open, transparent discussion among the leaders of the firm and everyone. I mean, we have an on all hands call once a week, every Friday at 2:00, just to talk about whatever issues. It's not always about this. Sometimes it's just about how to cope and get through this. It's when leadership leadership is so critical I'm blessed to be at a firm where it's been really good and victim, but I think there's ownership when you see this sort of challenge, and instead of for the hills and running on the ground and kind of covering your head, it's addressing it and moving on, because it'd be easy just for a couple of weeks just to sit there and analysis paralysis, but by taking action and just saying, okay, we're going to address this, communicate with not only with your employees, but also with your lenders and with your key business partners is critical. And they always talk VA fund. Like Jamie said, it's as a kid, it's drummed into your head. There might have that rainy day. Well, gosh, we actually had it here. And there are those who were ready, and I'm amazed at how many companies have just been able to go business as usual. A couple manufacturers in town that are just busy as all get out. They continue to be. Part of it's luck. I mean, part of it's fortunate in that they are in industry, and that's essential, and then the needs are still there. But they also were ready to go when something happened. They're just planning ahead. So it's been quite the dynamic, quite the ride.
Jamie, we've got 4 months left till December 31st. We don't know whether it's going to be the pandemic's going to be extended or not. But what advice would you give to business owners and our viewers for the next 4 months?
Wow, a lot to happen the next 4 months, Pandy. So going through it from March to now, what I would say is, as much as possible, stay the course. Not from a business strategist. I'm not a business strategist, so Bob alluded to it. Speak with your attorneys, your accountants, those folks. When I say stay the course, I'm speaking purely from a benefit standpoint, and as much as you can from a 401k standpoint. I know they're big expenses. That 401k match, those healthcare premiums, those add up. So I completely understand. Some folks may not be in a position to do that, but as much as you can, I would say stay the course. The carriers are going to continue to provide coverage. I would advise you, if you can afford to pay your premium. We talked about this last time, premium or Pandy, pay that premium. Don't let it accumulate, because the carriers, that was one of the big things that we heard back when this first rolled out and the carriers were given that grace period, is a lot of business owners were shocked when they got that bill 2 or 3 months later for 3 months of premium. Well, the carriers still have to pay their obligations to the providers, so they're going to get their premiums. So if you've got the cash on hand to pay your benefits, please pay them out. And then when the time comes up, so the next 4 months is usually, I'd say 70 to 80% of businesses are going to be renewing their benefits, especially January 1st. Yeah. If you're in a cash crunch, if you're in a position where you need to make some sacrifice on your benefits to keep affordability, but also to keep offering some type of benefit for recruiting and retention, this is a great time, regardless of what size of renewal you get, to sit down and really dig in. You may get a great renewal that looks good on paper, but too oftentimes, it may be a third or fourth renewal with that same carrier that's added up over time, where a new carrier can come in and really provide a cost savings. Look at scaling back your benefit plan. As we talked about earlier, telemed's really taken off. Every health carrier in the country now has a telemed built into their plans. Look at some alternative drug solutions. Look at narrow formularies. Look at narrow networks on those new plan designs, and really dig in. But My best advice from a benefit standpoint is stay the course as much as you can, because we too will get through this. Don't get panicked by the election. You know, they cannot change the benefit world we live in overnight. And if we have a split House or a split Congress, I'm sorry, it doesn't matter. You know, as history's proven the last 10 years, it really doesn't matter at that point what the president to be says, because he's going to have to fight with the split Congress to get anything done. So, you know, the next renewal is not going to be the end of the world from a premium increase if President Trump wins, or Medicare for all if Biden wins. So I'm rambling now, but my point is, if you haven't caught on, is just stay the course, shop your benefits, do your due diligence really hard on your renewals this year, and you should be okay.
Bob, what about you? What are you telling your clients? What do they need to be focusing on?
They just need to focus on their business. They need to focus on exactly what they are doing. Cut out all the noise on the outside. I'm a big believer in the checks and balances system that our country has, and I stay away from the Facebook and all that sort of thing. And depending on what not many parties anymore, but if I'm in a discussion with a friend or something like that, it's and I've got friends on far left, you know, there's an alarmist on both ends, and I'm just, you know, that's even the checks and balances system, that one person's not going to change things so bad that it's just going to be focus on the business, focus on your family, focus on the things that you can control, own it, and do it, and don't make rash decisions, which is in tune with what Jamie's saying. You take a look at it, do what you did pre-pandemic, how is this decision going to affect my business? What's the best? We can only forecast to the best with the information we have, and use our advisors and talk to the people in our industries, and make the decision that way, not based on the political system. It's just it's so extreme, depending on what news channel you watch, of which I watch none of them. And that, to make the decision, what you're watching at 6:30 at night, don't do it that way. Just focus on what's going on 8 to 5 or whatever hours you have at the office, and focus in that world.
And I'm going to take two major takeaways from both of what you said. Number one, communicate. My gosh, come on, you've heard this. If you've been watching this show, you've heard us say it over and over and over again. Just tell them like it is. No, they're not always going to agree with you, and no, they're not always going to like what you have to say, but you don't always agree with everything you're getting, and you're not always happy with what you're having to deal with. But if you stick together and keep that culture of, you know, we're going to get through this together, it's going to work. And what's the second one? Of course, surround yourself with people who are better than you are in all these other areas that are having such a huge impact on you and your business. Your CPA, your banker, your employee benefits, your broker, your 401k broker, your labor law attorney, your HR consultant, and now we're going to add your general counsel. You guys, no one should be going through any of these decisions by themselves. I've got two new experts now here who are telling you the exact same thing. Jamie Charlton, Bob Brown, thank you so very, very much for being with us today. I really appreciate the information you provided for our viewers. Again, viewers, if you want any additional information, if you'd like to have further conversations with either one of them, please reach out to them. You can contact the station, or you can contact me, but we'll make sure that if you have anything, either one will be more than happy to help you. So much for the business side. Let's get back to HR, my favorite topic. You know, guys, it actually was a slow week. It was actually a slow week. If any of you have been watching the updates, you've been following the different things that have been happening. We really didn't have a lot. So today is going to be more of a review. One of the big things that came up that got into conversation was the number of fraudulent unemployment claims that are hitting around the country. If you have had to lay people off, you obviously know who your employees are, but did you realize that there are a number of scams now that are hitting the unemployment offices with individuals who are claiming to be other individuals or individuals who are claiming to have worked at employers that they never worked at. And I got hit with one with an individual in Hawaii who was claiming unemployment in Hawaii for a business located here in Cincinnati. So it kind of hit home for me. Please make sure that you've got a program in place for these unemployment claims. And I mean a program so simple as make sure that there's only 1 or 2 people completing any kind of unemployment claim. Centralize it so that somebody can't slip between the cracks and somebody can't forge or doctor paperwork. You also need to understand that your employees need to be educated on how they're giving their information out. You know, this is all basic training. We've talked about it with just the whole, what they call it, phishing issues that employers have with their employees. Well, this wouldn't be a bad topic to go back because now that those phishing scams are affecting unemployment claims and we can't afford money going to people who don't deserve it, right? So please get with your employees, help them understand how to control that information. Talk to your own employees about who's filling that paperwork out and who's completing that. And thirdly, check the cybersecurity issues in your company. And we're going to have another IT person come in here in a couple of weeks to talk about IT again. But if you haven't addressed that here recently, please go back and do that. Because we've got to control where the money's going in terms of this unemployment, and it should be going to the people who deserve it. Another major announcement I thought everybody should be paying attention to is the Internal Revenue's recent published question and answer segment in regards to shared leave policies. Listen, if your company hasn't thought about it, there is an opportunity for you to allow individuals to take PTO and put it into a general fund for other individuals who might have it much harder. I mean, these are hardship claims, obviously, but there is a program that the IRS has. They've just basically said, yeah, here are the rules. We'll accept this. Believe it or not, how many times have I told you, the Department of Labor is not the only governing body that oversees HR. The IRS is right up there. And there's 9 different guidelines to producing a program like this. But a couple of weeks ago, we were talking about how do we retain our employees? How do we develop programs that remind them that we are concerned about their well-being, that we are concerned about what they're facing and all the challenges they have, especially with being school, you know, all the schooling issue with the kids being home and you know, all the issues with COVID, obviously. But, you know, a leave share program might be something that your employees might embrace. And it would be something to discuss with them. Again, give them the power to decide, is this something that they would like to see? Is this something that they would use? Because obviously it's going to be from them, one employee to another. It's not going to be coming from the company. So there are guidelines on it. If you would like to get more information on that, just let me know. I also wanted to talk a little bit about some of the, guys, you know, we for 2 episodes here, we talked about stress and the impact that stress has on our employees. And with that, the rise we've seen in drug use because of depression and because of all the pressure people are in. So the EEOC recently put out some reminder guidelines and some revisions a little bit in terms of employee opioid use and the ADA. Now, you've heard Scott say on this show a number of times, if you are not trained and you cannot speak to the ADA with strong confidence, and I mean, that means you've been trained, not that you've read on the internet this or that. Guys, this is serious stuff. The ADA, FMLA, FLSA, NLRB, my favorite, they are not to be played with. So if you haven't been trained on it, please seek out that training. Scott's got it. I've got it. Your employment law lawyer will have it. But again, we're seeing more, and for me to be reading some of these decisions that the EEOC is making in regards to how the ADA relates to opioid use, you know, this is serious stuff. So be prepared for it. Please brush up on it. It's probably closer than you think. You can't plausible deniability just doesn't work on this kind of stuff. And the last thing you want to do is get caught between the 8 ball, right? You just don't want to do that. I also wanted to kind of bring up the fact that public nuisance cases are starting to rise. And we talked here a couple of weeks ago about the different claims and cases that were being filed during the sense of COVID based on COVID-related activities, discrimination, retaliation, remember the list? Well, now we've got several claims that are really getting close to home here in this market of employees stating that their employers prevented them from doing safe and proper health practices, that they're actually suing their companies. So one particular claim, and this is here in Kentucky, an employee said that the grocery store chain was prohibiting employees from wearing gloves during the pandemic. And the plaintiff literally said explicitly the company informed the workers that they could only wear gloves at work if they had a physician's letter and filed an ADA paperwork. Guys, if I said the grocery store, you would know it immediately. This is the HR person who made that decision would not be working for me. Let me just say that. And then here's another one with a major chain who's basically saying that they didn't provide the PPE to the employees, but worse yet, when an employee showed symptoms, they refused to allow them to go off on work. They made them work. Now, I'll tell any of my clients, look, anyone can sue for any reason. Doesn't mean that they're going to win. That's the way it is. People can sue for anything they want to sue. The catch is, if you're doing all the right things, it's less likely that they will. And it's far more likely that you're going to win. I'm telling you this because now Nevada has passed a law here on August 11th. The governor signed legislation that shields non-healthcare businesses from lawsuits that rise out of COVID-19 infections when a business follows state and local health standards. Look, they're basically saying, and that's the only state that I can find that has that right now, but what they're saying is, look, if you're doing all the right things, your employees will know that you're putting all those preventive circumstances in place, and it's so unlikely that they're going to get COVID while they're at work, that, yeah, we got your back. And the state has put together 9 different things that they want in a COVID response plan. Now, I've had a couple of clients call and say, as they're filling out audit forms for their clients, one of the questions in those audits is, does the company have a COVID response plan? This is not a bad idea. If you have not thought about that, and we really haven't spent a lot of time on that here on this show, and maybe we should, but a COVID response plan is just a responsible, prudent way of saying, look, we're planning ahead. We're going to be proactive, and we're going to train all of our employees on things, as Scott has said over and over again, on how to wear a mask, how to wash your hands, how to sanitize, what the symptoms are. But we're going to even go beyond that. Look, this is not going away. And what I'm starting to hear and see with some situations is that employers are kind of sitting back and going, yeah, everybody's kind of forgotten about it. We're all going to get back to the swing of things. It's business as usual as much as we can. And yeah, we didn't get the bathrooms clean today, but the cleaning people will be in tomorrow. Not good enough. It's not good enough. So I really need you, if you are a business owner or if you're a GM, I really need you to go back and take a hard look at just where you are in terms of all of that, because you can't slip up. There's no relaxing right now. This is not over. Again, I just gave you December 31st as the end of the pandemic, but we don't know that. That's a number on a piece of paper. We have no idea where this virus is going, and we have no idea how the government's going to respond to it. So with that said, OSHA just added to their frequently asked questions a recommendation that employers encourage their workforce Now, if any of you read that 17-page document that I showed you here a couple weeks ago, their previous terms were may choose to wear coverings as a means of source control. Now there's using the word encourage. What does that mean? That means that even OSHA is standing here saying, guys, we're not saying that it's more effective than social distancing, because OSHA is going to stick to that social distancing aspect of saying that's the safest way to keep people, away from the virus. However, wearing masks is second, and a really close second. So you guys, please understand, wearing masks is essential unless you have an individual who can't, and you're getting a documentation to prove that that is a medical condition. Yes, we get it. We totally get it. But this is not going away, and masks are going to be very, very serious. So your training tip for today, I'm going to go right into it, is training your employees and your staff on how to handle somebody who chooses not to wear a mask into your building. Now, we all see it. We see the signs on the Wendy's. We see the signs at the grocery store. We see the signs at the doctor's office. Everybody's posting it because that's what they're supposed to do, and they're going through the motion. But what happens when somebody decides, it doesn't matter, and they stroll in without it? And I'll be very truthful, I did it the other day. I strolled in a Wendy's, and everybody looked at me. Everybody else was masked. I wasn't. And I thought, let's see how long this takes. And guys, it didn't. They didn't say anything. Maybe they were trained not to say anything. But what are you doing with your employees? How have you trained them to react? And remember, there are circumstances where a customer or a client can ask for an accommodation to not wear a mask. They have to do that. They have to look at you and understand. They have to say, hey, I need an accommodation. I can't wear a mask, and here's my reason. What are you training your employees to accept? How are you training your employees to talk to an outsider, a visitor, a customer, a client? This is serious because this, as we've said over and over again, I don't see these masks going away for a while. I just don't. And I went to a store the other day, and she got upset. The woman at the cashier got upset because I handed cash to the individual, and she had to sanitize her hands, and she had to put rubber gloves on. And I went, oh gosh, this is where we're at right now. And she says, well, it is for me. And she got real emotional about it. So my second training tip is either train your people who have to deal with the public on how to react, or get them in a different position. Because if you've got individuals who aren't reacting well to this and aren't able to deal with possible exposure or the interaction with other individuals, then you need to get them in a place away where they feel safe and secure, or where they can telework. Because it made a really bad impression on me and everybody else standing in line. And that's not what this is all about either. We've got to work together. We've got to deal with this the best we possibly can. Next week, I'm going to have somebody in to talk to us about all the different types of masks and all the different types of settings by which certain masks are accepted. The neck gaiters are now being questioned by Duke University as being far too thin and highly inefficient for holding back the virus. And I'm seeing so many more of those. And those are the wraps that come around your neck. They just slide up over your nose. They look a whole lot better than a mask. They're easier to breathe in, but if they're highly ineffective, why are we even accepting them? I'm also going to have Mary Miller back from Jancoa. She's going to talk to us about a training checklist. What do employers need to have to be absolutely assured that they are cleaning to the highest level, and that the people who are doing the cleaning are trained to be aware of COVID standards. We are also going to keep on this topic of a review of the last 5 months. And I've got a whole list of experts and individuals planned for the next few weeks. I just tell you, I love doing this show, and I appreciate you all coming every week. Keep your questions coming in. Jamie Charlton from Saxon Financial, Bob Brown from Graydon. thank you so much for being with us. We know you guys have busy schedules and it's hard for you guys to do this, but it means a lot to our viewers. Thank you again to ICRC-TV. One more hour, but it's all for you guys. So please take care of yourself. My name is Pandy Pridemore. We'll see you next week.